everybody. Welcome back to the Parent Confidence Lab. We are so excited to have Melanie Reynolds here to join with us. And she is a phenomenal pediatric palliative care nurse, so doing some of the hardest work I think that exists, nurse practitioner and a strategic program leader, advancing the development of the advanced practice workforce in academic pediatric settings. She's at Children's Hospital Los Angeles, where she serves with the Office of Advanced Practice, leading initiatives that standardize onboarding, build professional development, and performance alignment for APPs across service lines. So thank you, Melanie Reynolds, so much for joining us. We're really excited to have you today. And kind of my first question just relates to, wow, that's a difficult field. How did you get into palliative care, especially pediatric palliative care? What led you there, and kind of what's your experience been, over those years you were working there?
Yeah. So when I was a nurse, I was a pediatric ICU nurse and also a pediatric cardiac ICU nurse. So we took care of just kids that had big heart surgeries, basically. And I had started in my NP program at that point, and I was taking care of a little boy overnight, and he had just had open heart surgery the day before. So they completely open their chest. So you can imagine that it would be very painful, and they have tubes that are still in their chest. And he was awake and alert, and he was in so much pain that he didn't want to move, and he just had tears rolling down his eyes, and everything that I did to try and make him feel better just wasn't working. And I was asking for more and more pain medications, which the providers were hesitant to give. And it was in the middle of the night as well. So that experience really made me lit a fire that I was like, we need to treat these patients better with the appropriate medications that are going to do that for them. And so at the time in school, I was choosing electives, and there was adult palliative care. And so I was like, oh, maybe I could do an elective in that. And I was specifically doing pediatrics. And so I did that, and I worked with the program director I went to New York University. So I worked with the adult program director to actually build a pediatric palliative care concentration at NYU. So I was the first person in that. And so I took extra classes in pediatric palliative care, extra clinical rotations, doing home visits in the Bronx in New York, and of pediatric patients that had chronic complex diseases or were closer to the end of their life. So getting all of those experiences really got me into it. And then my first job as a nurse practitioner was a pain management nurse practitioner at Seattle Children's.
Wow. So truly full circle there.
Yeah.
You were in charge of the pain medication. Wow.
Yes.
Wow.
Very powerful.
And, in terms of your work, with children in particular, was that happenstance, throughout your nursing program, or did you specifically come into nursing saying, hey, I want to work with children? And what has your experience been working with children overall?
Yeah. So I'm the first person in my family to go to college. And from basically when I started talking, I said I wanted to be a doctor. My favorite show that I still remember as a toddler was Rescue 911 in the 1980s or 90s. And so I would watch that as a small child. And I always said that I wanted to be a doctor. And I always said I wanted it to be within pediatrics. And so I decided to do nursing school as like my undergraduate to really get that good experience before going to medical school. And as I was in nursing school, I really enjoyed that connection that I have with patients and their families. And so I decided to stay within nursing. And at the end of nursing school, I actually I concentrated in pediatrics there. When I graduated, it was 2009, so it was a little bit more difficult to get a job, if anyone remembers then. So my first nursing role was actually with adults, but I quickly pivoted from that after 18 months to my first pediatric ICU job. And so I've basically been doing pediatrics for 20 something years. And it's working with children and their families is just a very different experience and so much more rewarding than it is necessarily working with the adult population, in my opinion. everyone asks me, oh, how can you do what you do? And I'm like, well, how can you do what you do? So I think we're all made for the populations that we can really impact and work with well.
That's
And I
wonderful.
think that did that answer both of your questions?
Absolutely.
Yeah. That's wonderful. And I imagine so in palliative care, you're working with children with kind of serious illnesses. What has that experience been like for you? And what and if any advice you have for parents who might be living with a child who has a serious illness?
Yeah. I mean, even thinking about these things is hard to really articulate the feelings that are around them because it is just so deep and um, potentially devastating for many, many people. Um, and honestly, my opinions changed a lot after I had my own children because I did this before having children. And so it was very different. And I'm sure a lot of us out there know our mom brains change as soon as that first one comes out, and things are just very different for you. So my experience working within palliative care has really been mostly focused on the pain management of those kids, and making sure that they can do what they want to do in their either their final days, or they could be children with chronic complex diseases that are just life limiting. It doesn't necessarily mean that they are actively going to pass away at any time soon within 6 months or whatever that has to be to become a hospice patient. Palliative care is more of an umbrella that just takes care of the more medically complex. So for me, it was really rewarding to be able to come up with creative things that would help patients live their life to their fullest and be able to do what they wanted for themselves. Um, One instance that I'm thinking as an example is I had a early teenage boy who had a osteosarcoma, which is a bone cancer, and it can be extremely painful. And he was at the end of his life, but he did not want to be in the hospital, but they couldn't control his pain at home. So we kind of came up with this creative way to be able to get him home, to be where he wanted, to be around his family, to be with his pets and his siblings. And what we did is we put a catheter by the nerve in his back that was feeding where that tumor was causing a lot of pain, and put numbing medicine. It was an epidural, um, if you are familiar with that. And so basically, we had an epidural continuously running so that he couldn't feel the tumor anymore. So he could be alert and awake because he's not having to take a bunch of pain medications. He could be present and he wasn't miserable. And so we had to pull a lot of strings with hospice and getting a lot of care coordination for him to go home, but he was able to go home and die peacefully with his family. So that's just one example of the many instances and patients that I've taken care of and how it's rewarding to be able to take care of them.
Wow. Wow, it's incredible. What you
Wow.
did for him in those last days and months of his life is incredible.
Yeah.
Thank you.
Absolutely. Second that. And, as parents who have been there, who have gone through palliative care for our own daughter, we know that the work that you're doing is really God's work, and it's really the work of love across the board, because I would say firsthand, there's no worse place than a parent can be. But making sure that those last days and final moments are very special, and in a way that honors the life and that's the wants and the wishes of your patients. You've done a lot of incredible things. You've won the Heart of Fellowship Award, helping a lot of other nurses that are also following your footsteps, but also advancing the practices in pediatrics. And so you really are a leader, a teacher, an advocate. And in those roles, what's your favorite thing now, being on this side, that you kind of encompass really helping others, in their learning journey and their journey as nurses?
So in my new role,
Yeah.
yeah, so my new role is very, very different. And it's basically I oversee the professional development of all of our advanced practice providers. So those are nurse practitioners, physician associates, nurse anesthetists, and they are the ones doing the work that I discussed earlier. And so now I've taken a step back to be able to support them so that they can be there, be fully present for the kiddos that they're taking care of. And so that they are learning the newest cutting edge education, that they feel supported in their work environment, and that we are addressing any of their issues with wellness and burnout and just feeling like they are part of our institution and that they can deliver high quality care to our patients. And so that's been rewarding in a very different way, because before I started, they didn't have any of those resources. So building education programs, I have one that's called preceptor development. So that is helping support the people that are teaching the new people that we're hiring, helping them know how to teach. It's very different to teach adults than it is to teach children. And so adult learning strategies and how to create a psychologically safe environment for the coworkers that they're working with. And then most recently, you mentioned the Heart of the Fellowship Award. I got that with graduating our inaugural cohort of advanced practice provider fellows. And so it's a 1-year program that I created to support new to practice nurse practitioners and physician associates through their first year. That is really, really hard. The first 2 years of being an advanced practice provider are very hard because it's a very difficult transition going from being a bedside nurse, for example, to now being a provider. So, our first cohort graduated, and it was such a proud moment. I was there with them through that whole year. They come in bright-eyed and bushy-tailed and super excited to be there. And then about halfway through, they're feeling it. It's hard. And then to see them graduate and succeed, and how much they've grown and gotten into the projects that they're working on and the relationships that they've built and how they've grown in their professionalism is just, I called myself their proud mama bear, and I was going to be protecting them at all costs from anybody around. So that's been really awesome to see something that, it was an idea that I had on a whiteboard, and to see it come full circle has been really cool to watch.
That's amazing. And what do you think when you think of kind of the training that they need, the support they need? Thinking more broadly, how can all of us benefit from these kinds of things? Where do you find that, everybody listening probably could benefit from some of what your staff are learning?
I mean, if you are a patient in an institution, you want your provider to be happy. You want them to be engaged. You want them to be not burnt out. And so if we're able to foster an environment to where our providers are safe, psychologically safe, happy, our patients are going to see that outcome, and they're going to be have better satisfaction. They're going to have better care and better outcomes in the care that they receive.
Sure.
So we know as parents ourselves, we are not, the experts in the room. We don't know, everything that medical providers do know, but parents also, on the other hand, spend a lot of time with their kids, and whether they're in the hospital, clinic, or in the home, parents are usually the primary caregiver in most cases. And so from a nurse's perspective, is there, anything that parents can do to really help make your job easier? Whether it's insights that they bring from how the child is doing at home, behavior development or condition otherwise. What's your message to parents to be a very collaborative, proactive, and advocate at the end of the day, with the work that you're doing?
I mean, parents know their kids better than anybody else. And so you are, and most likely going to be their voice. Obviously, as they get older, they're going to have more of a voice, or maybe they were 3. I have a 3-year-old and she has a voice. But coming to the appointment, knowing what your concern is. And sometimes you don't know. Sometimes it's just that gut feeling, like, I know something's wrong. and don't be afraid to speak up. I know people are afraid of the white coat and they're afraid to overstep or say anything that they shouldn't be, but really you are where we are getting our information, and we need to know what you know so that we can best take care of your child. An example that I have from another one I have is we had a kiddo who was developmentally delayed, and the parents weren't at the bedside, and the child was laughing, giggling, and so everyone thought things were great. And then the parent came in and was very, very upset because this child in particular would express their pain through laughing. But we didn't know that because everybody else, most people, you expect that laughing is going to be that they are not in pain and that they are doing well. So it is really important for parents to be able to tell us, oh, my child is, if they're laughing, that means they're in pain. So that's just a pretty extreme example of why it's so important for parents to be able to engage and be open and honest with what's going on with their kiddo.
I want to just ask another follow-up question to that. Can you think of a time in your 2-decade plus long career where a parent bringing information to you in a fashion that helps make your clinical insights, observational insights better, change outcomes, for the good? Has there been? Can you recall any kind of instance that actually made a big difference where the parent wasn't afraid to speak up and they were being that agent of change to really help your job as a nurse?
Yes. It happens all the time, but the first one that's popping into my mind is kind of funny. Um, the patient was 2 or 3 years old, and all of my examples are going to be pain medicine related because that's basically what I did. She had a cancer that was in her stomach, and she had been in the ICU for a really long time, but was now doing better and was still on a lot of pain medications and complaining of pain every time a nurse or a provider walked in the door. She would be playing and then see them and say, "Oh no, my tummy hurts." And then they would give her pain medicine, and as soon as the machine beeped, she would be okay. She was 2 or 3, very, very young. So I came to see them because I was a consult service. So the primary team called and said, "Hey, this girl's having a lot of pain. We can't really figure out why it's from. We don't know why." So I came and I started talking to the mom, and the mom was very open with what she thought was going on. And she really hit it right on the head, was what it ended up being. She said, I think like I said, she was on a lot of pain medicine and had been for a very long time. And there was a language barrier between myself and the mom. So we were using interpreters and stuff. So this isn't exactly what she said, but she was alluding to thinking that the child was addicted to the pain medicine and was not actually in pain, but she liked having the doses of pain medicine. Addiction and all of that is a whole nother route that we would go down, but that was just the way that it was in between the two different languages. So what I ended up doing was decreasing the amount of pain medication that the patient was on and giving her some other medications that would help those angry nerve endings that were there from the cancer that she had, and also all of the extra pain medicine. So over time, eventually we got the medicine down and she went home, was doing better. And the mom called me randomly and she's like, "I have to tell you something." The little girl told her that she pooped out her pain monster that was in her stomach, and she was feeling much better. So that was very helpful for her to help me figure out what was going on.
I think that will stick with me. Pooped out my pain monster. Have to tell my children that one. That's good. That's interesting. I can imagine that's difficult with really young kids figuring out, like, yes, in pain, no, and how much. That must be a really difficult process. So
Yeah, and you have to believe them.
Yeah.
And we have to believe everybody that says they're in pain. It's a subjective, or it's an objective experience, but still you kind of got to figure out what's going on and why that's there.
Yeah, which is very hard when people can't express themselves as well. And
Mhm.
that,
Yeah.
wow. Now, I can imagine that. I mean, even hearing your stories, like this is pretty like emotionally intense work. How did you manage it? And how did you go into work every day knowing that, some of your patients might only have a few weeks or a few days? And how did you mentally and emotionally kind of handle that?
So the two different me's, the pre-kids and post-kids, it was very different. Before I had my own kids, I did a pretty good job of walking out the door and leaving that there and then picking it back up when I got to work. So I was pretty good at separating my outside life and my work life. Um, that became a lot harder when I would be talking to parents and I would see their child in their bed and then imagine that being my situation or imagining that being my child. So that changed my mindset a lot and it made it a lot more difficult to be able to cope with it. Um, some of the things that helped me is not only did I take care of the palliative care patients, I also took care of patients that had a big surgery and they were going to get better and they would be okay. So it was a good mix of things that I could be like, okay, I need a day of just of seeing the kids that just had surgery today. Like I need a break away from this. And we had a team that would support each other in those things. If we were having a difficult situation that we just needed to extract ourselves from, we'd switch assignments so that somebody else could take that on. Um, but and these are I've now been teaching some strategies to the fellows that I'm bringing on. So something that I do is called an awe walk. And so it's discovering the awe of things around you. So not only is that a wall, it is a wall that is textured and I see the shine from the light and just really focusing on the details of something to really bring your brain around the awe of what's around you and feeling like you are a smaller part of this world, this universe, and whatever is around you. So that's a good strategy that I use, and a lot of my fellows really, really like it. And you can do it anywhere you are. I just did it on the wall that's in front of me. You can be intentional about your walks to and from work and appreciating the dewdrops on the flower that's across the way or whatever. If you like architecture, looking at the different architecture types as you're walking down the road. So that was a big one for me in trying to center myself before going into a difficult conversation or a difficult situation. And then also doing it again when leaving that to try and bring myself back to go see the next person.
Oh, that's amazing. And it's definitely something that resonates with us, gratitude kind of being that vehicle that kind of centers us and it gives you that perspective. So I know you can go through a lot of different emotions, but it seems like you have you've done a lot of work on centering. Um, you talk a lot about, I wanted to go back to what you said about pre and post kids for you. And so working with, kids and then having your own kids were two different, um, it seems like two different worlds for you. But in terms of, how your perspective changed, yeah, for good, for bad, for different, what was that, change for you and how would you describe that, perspective shift?
Yeah, I don't know if it's so much a perspective. It's more of I became more emotionally invested. Or it just hit me harder when I was seeing these difficult things. Because I couldn't pull myself away from it anymore. I was in it. I was more in it with them and that could be a good or a bad thing. For me or for them. Um, but it just made it to where I couldn't compartmentalize so well. And doing this work day in, day out, it's important to be able to kind of do that. And so it just made it a lot more difficult for me to be able to do that because I was on a different level of relation with the people that I was working with. And it
Yeah.
instilled more of a fear in me of, oh, this could be my kid
Yeah,
someday.
I can imagine. We had very powerful experiences with one of the first doctors who treated Aviva. she had like a 2-year-old, and when she was when Aviva was 9 days old, she like had a one-to-one with me, and she even like teared up and started crying a little bit and was like, look, I have a 2-year-old now. Like I can absolutely imagine what you're feeling. And like at the time, she's like, to leave the hospital with no answers, like I can imagine that for my 2-year-old, that would be really hard for me. And she like teared up and was crying a lot. And it was like so human and humane. And I was just like, wow, I was really touched by it. I still obviously remember it today. So I think, in some ways it can make you a better practitioner, to have that lived experience. I can imagine on the opposite end, it's very hard, emotionally when in these really difficult situations. And then I just remember thinking, I just remember having so much gratitude for the nurses who were taking care of Eva for her last few days. Like I just kept telling them, like, I don't know how you do this. Like, this must be so hard. Like, and she was telling me, she's like, I don't know how you do this. Like, you're going through the harder thing. Um, but I was just like in so much awe of the staff, particularly the nurses, because the doctors we worked with, they were a little rough around the edges. I will say we didn't have the best experience, but and probably because they've become desensitized. They've done it so much that they become a little desensitized. But I did feel like the nurses, were just so amazing. And I just remember being so grateful to them and being like, wow, thank you for doing this work. Because I can't think of anything harder in the world to do than like taking care of our baby who may not be here much longer. So, first of all, thank you to you and all of the amazing practitioners that you work with. Um, and then I guess the question is, imagine, you have a family like us who's in there. Maybe it's a serious illness that might have, 6 to 12 months, or maybe it's, something that they do have a chance to survive. But kind of what advice, like how do you tell them, like what do you say to them? What advice did you give to them in those moments? Like how do you support those parents through those like some of the hardest moments of their life?
I think I don't necessarily like to give advice because everybody is so different. And advice for one person may be not good advice for somebody else. And that advice may actually trigger that other person. So I don't like to just offer full up advice. Um, but I do like to be present and learn about them so that I can then help guide them to things that might be helpful for them. So each individual is going to be different. Each family is going to be different in what their wants and needs are. Some people are going to have very large support systems and family members all around them. And some people, it is a single mom and they have literally nobody else. So it's what do you need and trying to find that for them and finding the resources that can help them with that. And then I guess if there's any broad advice, I would say just doing what you can to be present in the moment with your child while you have them and really appreciating those moments of clarity or those moments that they are wanting to interact with you or whatever it is, and really taking those in so that you can hold on to them, because you don't know when those things you won't have those opportunities anymore.
I really think that's one thing that all parents can really, benefit from, is really being present in the moment, with your child. And certainly, we tomorrow's uncertain. Nobody really knows, when those moments happen, but they are very precious. And being able to, form that bond, that connection with your child, whether they live for 10 years, 10 days, or 100 years, right? Those are really formative, really foundational. And, my question to you is, as a mother yourself, knowing what you know now, and, going through the parenthood journey as well as the nursing practitioner journey, what advice would you have for parents, that you might have not known before you became a parent yourself? And so this is maybe looking at your own personal experience, but, um, and I know there's, I know your opinion on recommendations, but just even something advice that could be helpful for one parent out there. What would you tell them?
So just like my basic mom advice that I give people.
Sure.
Um, oh boy. Sorry, I'm totally blanking on this one.
There's too many to count, right? But
My first, anytime I find out somebody's about to have a baby, I'm like, get a snoo, is what I say to them, so that your baby can sleep through the night, because your sleep has to happen. That's my main one that I always go to. Um, let's see. And then there's also all the things of like, no one ever told me that this was going to be like this. And of course, I'm blanking on I know there are many of them, but I'm blanking on what they are. Sorry, I'm failing this question.
yeah, no, I mean that's definitely parent fog, right? Like we get that all the time. But I mean, there's a lot of other. We can come back. We can circle back on that one, Melanie. But yeah, we'll just have a few more questions, and so we can kind of edit this out. So, but yeah.
Well, and we are coming close to finish to keeping it short. But I guess usually the way we ask that question, and maybe it will help, but is you know, looking back at your own life when you first became a mom, what advice would you give your younger self about becoming a mother, and what do you wish you had maybe known or done differently?
Um, I think I had a pretty good expectation of what I was getting into, just because I've been working around children for a very long time. And before I was a nurse, I was a nanny for 4 years in college, and I've been babysitting. I was talking to somebody the other day, and I was asking for a babysitter, and they said they had 11-year-old daughters. I was like, "Oh, can they babysit?" And they're like, "Oh no, they're too young." I was like, "I babysat 4 kids when I was 10 years old." So, I've
Me
been
too.
around kids a lot. I was like, "What is this? I put in work." Um, so I had a pretty good idea of what I was getting into. I think for me, it was a lot of, since I am so familiar with children, it was a lot of orienting my husband into what fatherhood would be and what having children would be, because he had held one baby one time before that. So helping him navigate through those things, I didn't necessarily anticipate those. So that was Daddy 101 classes were very, very helpful. So like I think they offer them when you're pregnant, you can go do CPR classes, parent classes. They had a dad class that was really, really helpful for him. Um, so I think that's probably the main thing that I wasn't expecting, is just I innately knew what I had to do because I had been doing it for so long, but I didn't take into account that there was somebody else in the picture that didn't necessarily have that experience. Um, and another one, even when I went to have my son, so he's 6 years old now, um, in preparation for the whole birthing process, I prepared my husband for a vaginal delivery, and it ended up being a C-section. And he really did not know what to do with that. And it was traumatizing for the both of us. And I honestly, my brain didn't even go there either. So would say, prepare yourself for a C-section is always a possibility. And what that entails and how it can be very different and very jarring, to go from one plan to switching. And then it's also a traumatizing experience that you have to live through. So that's probably my number one as I thought through.
Yeah, I mean it's a really interesting perspective, and I'm glad you shared that, Melanie, because it seems like you had a world of experience starting from when you were 10 years old, to prepare to become a mom, and you had some expectations going into it, whereas it sounds like your partner was of a different different type of experience, and so a lot of times those expectations are built around the experience levels that you have, and so trying to get on the same page or being able to kind of align. It sounds like there's a lot of coaching, educating across the board, but it sounds like there's a very collaborative partnership overall. But sometimes when you're expecting one thing, a vaginal delivery, versus another thing, a C-section, a lot of times that can throw throw a wrench, right, into what the expectations are. And that's usually the case across parenthoods where, there's a lot of differences. Um, but yeah, thanks, Mike. Any other ways that you found helps close that gap? If you think about partners that are on different wavelengths, maybe how do you kind of close that gap in alignment?
I mean, I think, and this is also like my career now, like education, right? And so that they understand why we're doing something. So my husband is also not in the medical field. He's an engineer, very analytical, and needs the whys for everything that we're doing. So, um, for example, car seat safety. My now 3-year-old, she's still sitting backwards in her car seat, and he's like, "Well, she wants to turn around. Like, let's have her turn around." And then it's educating him as, "Well, this is why we're not turning her around, because she's still too small, and it's safer if she's backwards. Because if there's an accident, she could hurt her neck really, really tragically. So that's why we're not going to do that." Oh, okay. And then, but if I don't give those answers, it's, well, she wants to, and just like let her do it. But so I think just being open about and communicating the why as to why you're doing something so that everybody's on the same page as to the reasoning behind something, and there's no animosity around it. It's just science.
Yeah.
Yes, I would say my husband's very likes his science too. So whenever I like needed to justify something, wouldn't necessarily think it's a great idea until I had like some article. I'm like, well, this article says that if we do it this way, for whatever it is, and then he'd be like, oh, okay. So I can completely resonate with that. Well, thank you. We're just about out of time. Thank you so much for coming in to chat with us. Thank you for the amazing work that you've been doing and now the work that you're doing to train other providers. It's been a great pleasure to be with you, and we're very grateful for your time today.